Hi, I'm Dr. Taj. I am in Los Angeles with two of the most amazing implant patients. I'm so proud to see you today and thank you for coming. Carter, James, and Drew.
Yes.
So, how are you doing today?
I'm doing fantastic, Doctor. I'm really grateful to be here along with Drew. I think we're going to have ourselves one phenomenal conversation, talk about something very personal, exciting, and one of a kind.
So, on the internet and on social media, there's a lot of conversations by implant surgeons and not a lot about patients. There's short clips of testimonials, but today we're going to go into depth. We're going to talk about your experience and how this happened, what was the reason you achieved this surgery, and how has it been? When was your procedure, Carl?
Mine was April 22nd, 2021. And the reason why I was so wanting to do something like this is because it's been plaguing me for quite some time. I felt like I lacked confidence. I felt like I lacked self-esteem since middle school, frankly, because boys will be boys, we'll taunt each other, we'll say ridiculous things about one another, criticize our bodies. And it just hit me to a point where I said to myself, one day, once I have the means to do this, I will accomplish this and get the surgery if necessary. And thankfully, the implant was available. And I said, yes, let's do this, because I've wanted this for quite some time.
Patients who contact me for implant, as many hundreds of patients a year come to me for consultation, they're all normal people. They come from all socioeconomic statuses. They are straight, gay, married, single, and they're normal people. And they just want to improve their confidence. And so how has it been, your experience? Do you feel like this has given you more confidence?
On a scale from 1 to 10, Doctor, I would say it has been in 1,000, because I feel like every aspect of my life, I feel like I'm ready to wake up and embrace a brand new day, personally and professionally. Like I'm ready to take on the world, conquer it in a very positive way, go in the right direction where I can say, hey, whether I am naked or clothed, I feel good in the skin I'm in.
You know, you mentioned a very important point. It is not just what I feel, patients telling me they feel confident about themselves. The wives or their girlfriends also, or their boyfriend, they also tell me that he just feels he's out of his skin. He has more confidence. For me, who has not had this experience of having an implant, I don't know how that feels, because for me, it has not been an experience of my own, but I hear it all the time. So tell me, Drew, what about you? Tell me about when did you have the surgery? And tell me a little details about you.
It's been almost a decade now. Back in 2016 in May, like maybe middle of May.
So as you know, many patients who get the implant, they have different experiences, especially post-operative period. You know, sometimes patients have some persistent swelling. Some people have what we call hematomas or seromas, just like any surgery. So tell me about your post-op experience and what you did to have a successful result. Tell us a little bit more detail. Let's get into the details of what is it that will make a successful result for the implant patient that you have had it so many years ago and you're still doing well.
Yeah, the best thing that I can encourage every man to do is like listen to the surgeon, listen to the doctor, take your medications, no heavy lifting. They're very specific with what to do and what not to do. So basically just follow the script, because the doctor, your surgeon, is very persistent in saying, here's what we need to do in order for you to have a successful recovery. And so everything is lined up for you, the medications you need to take, you know, basically it's written in great detail. And so I followed everything by the book. And I also had a friend with me who was willing to help me walk around, because I was not very mobile after the surgery. You'll find that out, that once you have the surgery, you're gonna walk like a crippled cowboy. There's a little bit of humor in that, because I'm like, wow, why am I walking like I'm 87 years old and I feel like I have 90 pounds between my legs? It's not a fun, pleasant feeling. But the good news is that once you actually take the time to listen and not just be enthusiastic about your recovery, it is just so imperative for every patient who wants to do this or has done it to basically follow the rules, do it by the book, and you will be fine.
When did you begin sexual activity?
Afterwards, I would say like probably 6 months after I had the surgery, because it says specifically in ink, no sex, no masturbation for 6 to 8 weeks after surgery, and no heavy lifting in the gym. So for me, it was about 6 months.
How about you? Tell us about your experience post-op.
Post-op was very interesting because They give you the list of medications, but one of them is specifically so you don't get circulation in an area built up at night. Because you're adjusting, you're healing, you can't expand it too much. But when that's only for a few days, and when that started to happen again, the fiery sensation was kind of intense. But the strangest thing happened over like 2 weeks. So you get a little bit of circulation, it hurts, it hurts, it hurts. But a week after, you're like, it hurts, but it kind of feels good. Then about 2 weeks later, you're like, oh, this just feels good all the time. What is going on?
How much has your sensation been affected, or pleasure, orgasm?
Honestly, it feels more intense now. I'm not exactly sure I can explain how or why, but it's much more intense to the point where, like, whole body, you can see, like, you can just have complete, I guess, pleasure at that moment. And with previously, it wasn't like that. So with someone alone, all of it, it's just more intense.
How about the experience of your partners?
Oh, they love it. Like, they love it, and a bunch of people online love it too.
See, that's what I hear as well. I'm also a cosmetic surgeon. I treat women, men with body contouring, and a lot of the women that come to me for, liposuction, a lot of them have pneuma or implant before. And they tell me they just have more intense orgasms. They feel their boyfriend or husband a lot more. It's been an interesting finding that men who have premature ejaculation, they tend to last longer, which is actually a positive thing. Because let's say if someone lasts only a minute, they can last 4 to 5 minutes because the sensation is different. And it's not triggering that, what we call the unwanted orgasm. You just started 10 seconds ago and you're out. So how about you? How about your partners? Tell us about your partner's experience.
I feel like as a man, when I'm with my partners, they love the fact that it's like, wow, I know that you're with me because I can feel it the next morning. As silly as that sounds, it's like, wow, it was never like that pre-surgery. Because I was always very insecure with a partner. I always felt very inadequate. Like, am I pleasuring my partner enough? Or what am I doing wrong here? I feel very nervous. And you have what is called that, what's the word? Basically, it's that anxiety. Because pre-surgery, I felt like I was failing my partners consistently, and I felt like they're going to leave me to be with somebody else who can pleasure them. After the fact, I felt like, yes, because I feel bigger and stronger as a man in my own body, yes, they actually remember me, and it's like, it's a nice boost to not only the ego, but to your presence and your masculinity overall.
Many of you watching this show may say, this sounds like too good to be true. This is like an infomercial, one of these fake meetings, and they have two, testimonial patients and coming in and just saying, oh, a bunch of good stuff. And, let's get to the point. As a surgeon, I operate this procedure all the time. I don't have 100% success rate. If I did, I would be lying to your faces. Any type of surgery has potential complications. Bleeding, infection. We have the surgeons at the implant team. We have exhausted everything we can to improve this procedure. In the past 2 years, we completely changed the implant itself to a much better quality internal mechanism of support, and also changed the procedure. Several years ago, myself and Dr. Ellis, we changed the incision completely. Now the incision is not even in the top. I make an incision on the side of the scrotum, which is completely hidden. And I don't get into areas in the infrapubic space because we don't want to even disrupt any of that tissue. So the results are improving, but still the risk of complications are about 1 to 3% with bleeding and infection. Now, if there is an infection, it's important that the patients communicate with us. And unfortunately, some patients, they need to have their implant removed. And this is a tough conversation. Many of you think that, all surgeries can have complications. Of course, breast implants have also gone through decades of improvement. 20 years ago, they had a 15% removal rate from seroma, capsular contracture, which is also something that plagues us, which is a scar tissue formation. But it is important for you guys to know that we are continuously improving this procedure. I am quite happy with the way that I'm doing this procedure now. I see a lot of happy patients. My cell phone, I've given it to a lot of my patients, is filled with happy dicks. And I always tell my patients, please do not send dick pictures to my cell phone, because sometimes my kids are playing on it and they're like, Daddy, there's another doo-doo, and it showed up on your text message. There's another doo-doo. So I get a lot of this, and to be honest with you, I get a lot of scenes. People are like in their wife or boyfriend, and they're like, hey, take a look at your device, which is cool, but I don't think it's necessary.
Yeah.
No.
Carter, I don't know if you're a member of Reddit community, which is thousands of Penile patients. I am also a member of that, and I answer a lot of questions. Many people who are on Reddit, they know that I don't sugarcoat anything. And I actually sometimes say difficult things about implant and the Penile. And it is important as a surgeon that you are practicing safe medicine. You are not, sugarcoating things, because it's a big decision. You only have one shot to do a great job. And it is important that patients who choose penis enlargement, they are educated. It's not like, okay, I saw this commercial about, come for 7 fillers for $49.99. And as a special until end of this month, you will get another 3 fillers for another $3,000. But they don't talk about complications. They don't talk about that this only lasts 4 months. And then they got to keep more injections. So implant, again, is not a all happy, business. There are complications with any surgery, including heart surgery, breast surgery, knee surgery, back surgery. They have high complication rates. So without sugarcoating anything, tell us any complications or problems that you had.
Thankfully, they were very bare minimum. When I recently got the implant in, unfortunately, it was crooked into the right. It didn't look really good. So from what I remember, when I went back in to see Dr. Ellis, he kind of looked at it with concern. So he's like, I'll be right back, sir. So I just basically was just lying there saying, so I just said a prayer. I said, okay, I'm ready for whatever. I'm ready for whatever. If they have to take it out, fine. If I do it, I have to do whatever I have to do, fine. He came back in and he was showing his assistants, how to adjust the implant. But thankfully, when he adjusted it where it was down, everything was fine. I was so grateful that 6-8 weeks later, that the pain was finally bearable.
So what you're talking about, Carter, is a potential shift of the implant. That has really reduced in incidence because we don't make the top cut anymore. And I use a new technique in the past 18 months called a no dead space technique. So I only open just enough space to fit the implant. I don't disrupt anything. So I go in and I only create enough space. So the implant sits like a glove inside, so it doesn't shift. However, there are potential reasons patients shift. Let me tell you how. Sometimes you wake up or you get up from a chair and you have to adjust your ball sack. You got to adjust your penis because the penis is bent. So what happens is when you wake up in the morning, it is possible that when you're laying on the side, the implant moves this way and it stays there. So, because the implant can shift. But the new way we do the procedure, it's becoming almost non-existent. Has it happened? Yeah. I had to adjust one patient about 6 months ago by just video. I made a video on Reddit of how to adjust it. Patients are doing it themselves. How about you, Drew? Don't sugarcoat anything. Tell us all the dirty stuff.
The weirdest thing was honestly the scar tissue buildup and having to get Kenalog injections to help ease some of the scar tissue forming. But initially, It's weird because imagine if there's that new integrated AI PlayStation 6 available and I'm going to give it to you, but you can't play with it for 5 weeks. You can stare at it, but you can't play with it. You can go around it, you can move things around it and make sure it's well taken care of, but don't you play with it. So it's a little bit of just like self-restraint that I've noticed because I've met some other people with the implant. And they told me that they had some, situations where the skin wore away because they played with it too soon. So really the like self-discipline to hold back, but it's worth it. So, and then later on, I sleep face down in the mattress. So just getting used to having to move my legs and move my penis in between my legs better. I'm not that mad at it though.
You brought a great point. The previous incision, because anytime you make an incision, the body forms collagen. So that's the reason they use canalog injections. So the scar, the incision from the skin extends because they have to close that space, becomes a scar. Fortunately, with the new procedure, you're going so far away. So if this is the penis, my incision is far away. So when I enter and I go in and I do my eversion and place the implant, when I close the incision, this incision is about 2 inches away from the penis. So there's no way that there's any scar formation. So that's a remarkable thing. I am proud to have done more than 850 implants. The complication rate has been continuously improving since I started the Scarless technique. We actually presented my data at the Sexual Medicine Society of North America about a year ago, where I showed the data of before the Scarless technique, after, and now with the no dead space technique. We have improved our irrigation system, our post-operative, instructions. So a lot of things have continuing to improve, just like, the new implant. The new implant has a internal support mechanism, which makes the implant amazing. Now, tell me a story of the first time you showed your penis to your partner.
Wow. Well, no sugarcoating. She was a little bit worried because, okay, how big is it going to be? And I was just with a big smile on my face. She's basically, just touched my pants. It's like, oh, it feels very semi-hard. And the great thing about the implant is that it always feels like the man is semi-erect. And that's when I felt like, okay, this is working. Somebody's getting excited. And then when I was able to get undressed, she's like, oh, this will be fine. So I felt like, okay, for the first time ever, it wasn't going to be like disappointment, but rather, oh, this is a good size. So basically, she was comfortable with me being with her. And, and not feeling like, okay, I'm going to destroy her or I'm going to, not pleasure her at all. So it felt like, as silly as it may sound, Goldilocks and the Three Bears. One of the porridges was just right. And I felt like Goldilocks' favorite porridge that night.
How about you, Drew? How did it go?
Are we talking about like on Twitter or like just in real life?
No, real life.
No, in real life, it's really interesting because I've noticed a lot of people across all spectrums, their eyes are bigger than their mouth, if you will. So you really have to learn how to become patient and just tell them to breathe and relax. Because they all end up loving it, but now there's an adjustment period. You can't go running straight to home base. You got to ease it around all 3 bases before you get there.
How about erections? How are the erections?
Man, every time I wake up with the so-called morning wood, I feel like I'm ready to take on my day. They feel just fine. They don't feel uncomfortable. They don't feel like an inconvenience. Of course, after you get the surgery, 6 to 8 weeks later, that's when you start to feel, okay, less pain and discomfort. Because when I got my first erection post-surgery, it felt painful. Like, oh, regret started to steep in. Why did I do this? But hey, it's going to be worth it if you are patient, like Drew said. So once I became patient, stayed disciplined, I felt like, yes, the erections are amazing. Like 3 years later, after I had my surgery, it's just like, I love it now more than ever. And my girlfriend right now, she loves the pictures too, so I can't complain. So
thousands of people love the pictures for me. So, no, that totally makes sense. And it's like, I mean, I'm kind of built, but there was always that, slight little discomfort that I was never small, but I was aggressively average. And now that I'm 40, I feel great about how I look, about how my body is. I don't have any regrets on the surgery itself. And to be able to walk around, because, even in the movies, like Ben Affleck said, walk around as if you've got a 9-inch cock. Now you get to actually experience that in real life, and then it just makes you more comfortable to enter in new situations with more confidence, with knowing that you are the man there.
So a lot of patients who have the implant procedure, in the beginning, first 3 to 4 months, they feel like their penis is more stiff, like they always have this woody going on. But I always reassure them that over time, it's going to soften up and your penis will become easily movable. You can move it up and down. Has this been your experience?
Absolutely, doctor. The way you said it is like perfect. I was like, oh, wow, why am I so stiff down there? It feels very discomforting. But at the same time, once I took the medications and did everything I was told to do, I'm like, oh, yes, it does soften up over time. It's like, yes, this is what I've always wanted. And doctor, I would encourage every man to look into this because if you want it, it's the best thing ever.
And you? Did you have the same stiffness in the beginning?
In the beginning, yes. Then it seemed like it just dropped into place. Like it just fit where it was supposed to fit. And now, it bounces around.
So I have
It is heavy, though. It's heavy. You're going to notice the weight difference. Like if you go for a jog, you can't hide it. And it's not like you're going to tuck it away in some tighty whities or something. That thing is be bouncing all over the place. And I don't think literally anyone that's ever going to get it is going to care.
True. So, this is the same analogy as the breast implant. I do a lot of breast implants. And in the beginning, when you put the breast implant under the muscle, the breast looks like it's sitting on the top of the clavicle and it sits high. But I always tell patients it's going to take 3 months, 6 months, 9 months for the breast to drop to become a teardrop. And it's the same concept. The implant has to adjust itself to your body. I always tell every patient that in the first 6 to 8 weeks, that's why we tell patients not to be, messing around, having sex. Your penis is pissed off. Your body is pissed off. The body is recognizing that something bad has happened because you traumatized the penis. So they want to send the entire, military, the entire army. But if you don't piss things off, relax and don't let it, they just send a couple of mall cops to look around and then they go away. And that's why you should not trigger a big invasion by your body's immune system.
The drain, though. Do you have the drain?
Drain, yes, true. The drain.
It's just this, it's a plastic tube sticking out of your body for like a week or a little bit more. And it's a little unnerving because the solution that you're getting out of there is antibiotic, antibacterial, all that shit. But it looks red, like brick red, like super red. And it is, and then you empty it into the toilet. And then you wake up the next morning, you're like, the ball, I rolled over on it. Now there's red shit everywhere. But as soon as that thing is gone, it's just like, as soon as he pulled it out, I was like, oh, my life feels better.
Right? Yeah, if it could look like a crime scene, I got mine done.
So, one of the interesting things that I found out is, sometimes patients have complications. And this is a difficult discussion, but we have to talk about it. Just like, we are ethical doctors and we have to tell everything that is happening. So a warning sign when I see a patient in the pre-op, because a lot of times I see patients coming from virtual visits and I've never met them before. I always tell them, listen, you have to shower more often because I think you have hygiene issues. And I'm very honest because remember, infections happen from their own skin. We don't introduce infections in the operating room. A lot of guys at night, they scratch themselves, especially with dirty fingers. There are multiple studies from orthopedics that patients infect their hip replacement from their nose. They're playing with their booger and then they scratch themselves. That's why they get MRSA infections because MRSA lives in your nose and, all over your body. So patients who develop an infection, obviously the implant has to be removed. It is a difficult psychological trauma to the patients. However, we stand by them. We help them recover using a penile rehabilitation protocol that has been established, where they use a vacuum pump, they use stretchers, they use special creams that I'm currently advocating that has been shown to help with scar tissue with Peyronie's disease, Peyronie's. And
I'm sure
the funny part is, I don't know what it is that they want the implant back. Very rarely I have seen patients who have the implant removed. They say, "Doc, that was the biggest mistake I made and I regret doing it." They say, "Listen, I understand what happened, but I want to recover. I want it back." And sometimes they're not good candidates to have it back. It's a difficult conversation because not everyone is a candidate for this type of surgery. And this is a fact. And we are very honest with them. So let's talk about your size. So what was your before and after? Can you give us a little bit more detail? So can you give us a kind of a representative view of what your length was stretched or just flaccid? Flaccid, non-stretched.
Okay, so flaccid, it was 3.5. Flaccid at the time. And erect at the time, I was about 5 5/8, something like this, around that size. In my own body, I always felt too small, too insignificant. After the fact, I've never measured myself erect, but post-surgery, after about a year, I'm now 6 inches flaccid, which is amazing. So I'm just like, wow. Because obviously not all one size fits all, no pun intended, but when I saw that, and I'm like, wow. This really does work, and it will benefit any man because, whatever your size, chances are you're gonna be a lot bigger, and it's amazing.
Tell us about your girth.
Oh, that's my favorite part, actually. It was I think it was about, I'm 6'6" now. I think before then I was about 3.5 and 4 inches around pre-surgery. And then after the surgery, it was 6'6" around. And I hope I'm saying that correctly because that was the one thing that I think impressed me and my partners the most was the girth.
Has your erect length been reduced? A lot of patients, they report on the social media on that, they have concerns about whether there is a loss of erect length. Now, obviously, this is again the conversation we need to have is there is a segment of the population. Just like breast implant, there is a concept of capsular contracture, which means there is a thick capsule that forms around the penis and it restricts the penis. What kind of patients have a high risk of developing it is the people who pissed off their immune system in the beginning. They called off the army. And those patients, they can develop loss of length. But a lot of patients, they are measuring their penis incorrectly. For example, we have done a study of comparing drawings of different girths. And when you look at the images, you say, oh my God, this guy's penis is a lot shorter than this one. But it's actually identical because the girth gives you a visual delusion that because it's thicker, it must be shorter. See, we always say that a thin guy looks taller and a fat guy looks shorter. But you could be standing next to each other and have identical height, but you just look like you are shorter. That's just kind of, it's a visual, mistake. Now,
That's
tell
the
me.
same thing with bodybuilders too, because they start growing these massive legs. So everyone thinks they have little tiny wieners because they're on stage with tree trunks hanging off and all of their blood's in their muscles, and they're, it's freezing on stage with this tiny little bikini on. It looks like they got nothing there, but I mean, bro, you can compare a bratwurst to a redwood. It's still going to look a lot smaller. But if you get it by itself, because I'm 6'4", so it's hard to get the dimensions right, which is why the first thing I do is I show them the comparison between a can of Gillette and me, and I'm bigger.
Can you share your visual pre and post, please?
Yeah, pre, I was 4 inches flaccid and just around 6 erect.
Nice.
Post, I'm pushing 8 on a good day in length, and I mean, I'm as thick as my wrist, so let me show you. So 7.5 in girth.
You brought up a very interesting point. The flaccid penis is in different states of what we call tumescence. Sometimes the penis is completely empty. Sometimes the penis, I'm not talking about erection. I'm talking about regular penis. So your flaccid length can vary, even with the implant. It can vary just like a normal person. Sometimes you walk around like a, very proud, even when you don't have implant. And sometimes you walk around, you're like, what happened to my penis? So that's a normal thing. There have been some recent discussions in the medical and urological community about patients who want to get penis enlargement. They have serious body dysmorphic disorder. They have psychiatric disorders. They need to be evaluated by psychiatrists because they have unrealistic expectations. But this discussion has not been really advocated for patients who want to get breast implants, has not been advocated for patients who want to have a Brazilian butt lift where they want to have a larger butts. Obviously, during our screening, we want to make sure that the patients have healthy bodies and emotional understanding of the consequences of this procedure. If a guy comes to me and says, Doc, my wife left me because I had a small penis and, she cheated on me. I have 100% sure it was because I'm short and the guy who she was cheating on was much bigger. I always tell them it is extremely unlikely that the reason your wife left you was because of your penis size. I don't know the whole detail, but it's very unlikely. That's a red flag because some men, they want to get a penis enlargement. They think they're going to get more women or they're going to get more men. They're going to be more attractive to partners. First of all, when you go to a bar or you go on a date or you show yourself as a person, they're not looking at your crotch. They always want to look at how nice you are, how well dressed you are, how you carry yourself. So that's not true. So the bedroom is a different issue. In my opinion, psychological assessment, pre-screening should be done, but it should not be absolutely required. Do you agree?
Absolutely, doctor. Yes.
I mean, in my practice, I perform implant in politicians, attorneys, hedge fund managers holding billions of dollars in New York City, doctors, surgeons, you name it, we offer this procedure. And we are more concerned about their understanding of their decision. There are many times I actually tell the patient, listen, this is not for you. Trust me. Just go take care of your body. Sometimes I see really obese patients and they're like, I have a small penis. I'm like, listen, you don't have a small penis. You have a completely normal penis. You're so big that your penis looks small. You need weight loss, you need exercise, or get a liposuction. Get liposuction, get all the fat out. I actually perform a ton of liposuction in men. I do high definition body contouring. I do a procedure under local anesthesia for guys who have big fat, pubic fat area like Mons. And I do the Mons liposuction. In 30 minutes, I take out 0.5 liter of fat. And that area is now flat. So
A lot of fat there.
But some people have a lot of fat. It's called the Mons fat. Yeah.
You ever just like really real talk them? Like, bro, I know 5 people and you're 4. Or I know 5 fat people and you're 4 of them. Like, is that what you tell them, or no? Just a little more under the table. Like, you could lose some. You're gentle about it, or you?
No,
right?
if people who have on the show who know me when I do the conversations, I am very frank. A few months ago, you guys are gonna die laughing from this. I had a consult in South Carolina with a very respecting patient. He was sitting in the bedroom and his wife was sitting. They looked very conservative, and he said, Doc, I want to get a penis enlargement because I feel very inadequate. And I was like, yeah, tell me a little bit more. He goes, we're a member of a swinger movement, and we go to the swinger parties, and I get very upset that I'm sitting there getting drunk, and none of the women want to sleep with me, and my wife is sleeping with everybody else, and I'm just sitting there watching my wife having sex with larger penises, and I'm the one sitting there, nobody has sex with me. And I told him, listen, buddy, you need to choose a swinger party where you're the biggest guy in town. Don't go to a big dick swinger party. Go to a regular swinger party. So you're the big guy. Don't you think it's a reasonable?
Yeah.
But I mean, not everyone can use a baseball bat, but everyone needs a toothpick. Let's go. Like, come on.
Hey, that's reasonable.
Just ethnically-wise, what is the number one ethnicity that you see in your...
Interestingly, 40% of my implant patients are African Americans. It is absolutely true. Why? So the African Americans have this huge burden of expectation. They are expected to have massive sizes, and if they don't, they actually are made fun of. They are losing dates, and it's a sad fact that your race and your expectations are being used as a type of reverse racism. So thank you, Carter and Drew, for coming down to LA. We are so happy that you joined us, and I hope I taught you a couple of things about the new surgery, and thank you so much for sharing your experience. Okay?
Absolutely.
Awesome. Thank you, doctor. Appreciate you. Thank you so much.
Thank you.